Hi, I'm Allison with New Little Life. I am a lactation consultant that specializes in pumping. So today we're going to talk about two really important things that are kind of hard to figure out which is which. We're going to talk about low milk output, low volume in the breast, versus low pumping output. We're trying to figure out which is which and what you can do about it. If you're new to the channel, please subscribe and turn on that notification bell so you can see when we have new videos. It's all geared toward breastfeeding and pumping specifically for working moms. So I hope we'll see you around. So this video is really going to be geared toward moms who are combining breastfeeding and pumping, okay? A good example of this is working moms who usually breastfeed at the breast at home and pump at work when they're away from their baby. This is also applicable though to exclusive pumpers or anyone that's pumping really. It can be really hard to tell if you actually have low supply or if you are just not getting out the milk that is already there with your pump. So anyway, I specialize in working with moms who combine both. So that's kind of who I'm talking to today. But if it works for you, here we go. Let's start out with a couple of definitions. Low milk supply means that you are not making enough milk to meet the needs of your baby. Doesn't necessarily mean that you can't, but for whatever reason, that is not happening. That is actual low milk supply. Low milk output or low pumping output is when you are not able to pump enough milk for your baby and what they're needing. All right? Two differences here. These things are not the same. To make it more confusing, low milk supply can be caused by consistently low pumping output, but low pumping output doesn't necessarily mean that you have low milk supply. It's kind of as clear as mud, I think. But both of them can go around masquerading as the other one. So let's dive through each of these so we can try and figure out what you're experiencing and how we can fix it. This is important because they're not fixed the same. These are two different problems and they have two different paths that you're going to need to go. All right. So first, let's start with low milk supply. If you actually have low milk supply, your baby is not getting enough milk. Okay. You will see signs in your baby like poor weight gain, poor diaper output, low diaper output for their age. Okay, so based on their age, if they're not having enough wet and dirty diapers every day, that's a sign they're not taking in enough food. And dehydration. Signs of dehydration include dry mouth, irritability, dark urine, tearless crying, sunken eyes, a divot in their fontanelle. Those are signs of severe dehydration. You definitely need to call your doctor, okay? There are also a lot of other indicators that the baby's not quite getting enough milk, but they are much harder to determine whether it's actually low milk supply or normal infant behavior or just things that make babies mad in general, okay? So some of those things would be like baby is fussy at the breast consistently. They take large bottles after feedings. Your breasts always feel empty. Again, those things don't necessarily mean you have low milk supply, so I am going to send you over to watch this video up here on things that are not low milk supply versus low milk supply. Anyway, milk supply is just crazy. I feel like this is one of the hardest things for moms to juggle and figure out, especially when you're combining breastfeeding and pumping, because when you're feeding at the breast, you don't get to see the numbers, right? And if the baby's growing well and stuff, we don't really care about the numbers, right? It's just working. And then when you start pumping, all of a sudden you have numbers and you're like, is this normal? I only pumped 2 ounces. Is that what my baby eats or is that not enough? Because babies vary a lot too. So when you combine these two, I feel like this is where things get really muddy and really confusing for moms. And you kind of need some help organizing all that, figuring out what's normal, what do we expect, that kind of thing. So here's some things that may contribute to low milk supply. And I am going to have to read these over here because this list is flipping long. Okay. So baby doesn't have a good latch or doesn't remove milk well. This can be caused by anatomical issues, lip, tongue, tie, all that kind of stuff, cleft palate, or the latch just isn't good. I mean, this happens sometimes, right? Baby doesn't get enough time at the breast, or you're skipping pumping sessions depending on what you're doing. If we're not removing the milk enough or enough times per day, that doesn't mean 12 times a day, right? But enough times. whatever that looks like for you based on the baby's age and your current milk supply. If that's not happening, you can have low milk supply. If you don't eat enough calories, or if you're not taking in enough fluids, or if you don't get enough rest, all of those things can be kind of a joke for a mom because you have a lot of stuff going on, right? I'm not saying you got to sleep through the night, but if you are like behind and you got the bags under your eyes and you are struggling, it's going to be hard to make milk, right? If you're eating 500 calories a day because you don't have time to eat, it's going to be hard to make milk. If you haven't had a drink of water in a week, right? It's going to be hard to make milk. I'm not saying you have to down the food in water to make this work, but those are risk factors, right? Stress is another big one. I know you're stressed. You're a new mom, and especially if you're working. Also, this is kind of a joke, but excessive stress makes it hard for those love hormones to let down your milk, right? Waiting too long to begin removing milk after birth. We got to start right away. Doesn't mean you can't get it back, but it does make it harder. Supplementing with formula. Your baby may take less milk from the breast, which in turn causes you to make less milk. And it can kind of be this downward cycle of lowering your milk supply because your body's just trying to respond to what you're telling it. Pacifier use. Are we using pacifiers in place of feeding the baby? That can be a problem. Pacifiers are not bad. And there's another video on pacifiers right here. But if we're using that instead of feeding them, keep in mind, a sleepy baby. This is really common in the beginning, and some babies are just sleepier at the breast than others, but if they're not eating enough because they're just so sleepy, if they have any kind of health condition that makes them that way, a heart problem or, anything else that they just are more sleepy than normal, that can cause low supply. Scheduled feedings rather than feeding on demand. That doesn't apply to pumping really because we do have to, your pump's not demanding milk, so we got to be more scheduled there, but when you're feeding at the breast, if you're scheduling them and you're like, nope, baby, it's not 2 hours yet, you can't eat yet, that can cause low milk supply. We like to let them eat whenever they want. All right. Limiting the length of feeds. So setting a timer and saying you get 15 minutes and then you are done. That can negatively affect your milk supply. Certain medications, especially birth controls with estrogen or, some other medications, antihistamines, cold medicines meant to dry you up, those will affect your milk supply. Certain medical conditions, obesity, if your baby was born premature, if you have high blood pressure, anemia, this list is long, diabetes, excessive blood loss during birth, retained placenta, history of thyroid or hormone disorders, previous breast surgeries, specifically breast reduction, we see the most problems with, breast trauma. Again, if you have any of that, it doesn't mean you will have low milk supply, but it could happen, right? If you're not breastfeeding or pumping correctly, right, your body's only going to respond to the milk that you remove. So we got to make sure that these things are happening right. If you decrease the number of times you feed or pump prematurely, so dropping that nighttime pump is my favorite thing to do, but if we do it too early, it can have a negative effect on your milk supply. Illness, if you get sick, especially if you have a fever, that can drop your supply. Drinking alcohol, smoking tobacco, being pregnant. Hopefully that's not it, but that can happen. Oh my gosh. And the return of your period. These are all things that can affect your supply where you actually have low milk supply and you are not making enough for your baby. Your breasts physically are not producing enough milk. Okay. That is different than low pumping output. A couple of signs of low pumping output include your breasts still feel full after pumping. They should feel emptied. They should be softer, right? If you can tell there's still milk in here, that's a problem. My favorite thing to do is to have moms hand express a little bit right after pumping. You'll always be able to get a little bit, but if you can easily get sprays of milk out, there is still milk in there that we did not get out with the pump. And that's a really good indication that something isn't happening right. Another sign of poor pumping output that is not low milk supply is the baby is breastfeeding well on the weekends and nights and when you're together. Baby's growing well. Breastfeeding is good. They don't seem extra hungry. And then you get to work and you're pumping 1 or 2 ounces per session combined. And you're like, there's no way because my baby's taking 20 ounces at daycare. How am I only pumping 9? That's not adding up. Or if the pumping amounts are significantly lower than you expect. I do think we need to have realistic expectations here, especially when you're combining breastfeeding and pumping, because your milk supply is being controlled by the pump and the baby. This is something we talk about extensively in my program because this is a really important part of managing your supply and figuring out how best to find normal, what's a problem, what's not a problem, okay? But if your amounts, like I said, you're pumping 1 ounce per session combined in place of a feeding, that's not enough, right? Your baby's eating more than an ounce. If it's been 2 hours since your last feed or pump, that's significantly lower than we would expect. Does that make sense? A few things that might contribute to this problem. Again, I'm going to read it because it's a long list. I wish this was easier for you guys, seriously. I mean, honestly, if I'm being honest, I wish that I didn't even have a job, that we were not forcing moms to go back to work this soon and even having to deal with this garbage. Like, just stay home and breastfeed for a year, 2 years, keep your job, keep getting paid, whatever. That's another video. Okay, things that contribute to low pumping output. Here we go. A poor performing pump. I hate to say that, but sometimes it's the pump. Sometimes it's not. So don't keep buying breast pumps. Watch this video here. Stop buying breast pumps to fix this problem. It's probably not the pump, but that can happen, okay? Inappropriate flange size. This is very common, right? And there's actually a whole huge module in my program on flange sizing because it's really, really important and it can make a big difference. You can probably get milk out with a flange that's too big. And I see this happening with a lot of moms because it doesn't hurt. It might be uncomfortable, but it's fine. Milk comes and you're like, I don't need any help. I'm good. And then when I get moms in the right flange size or they are able to find it on their own, because they've learned how to do that, they're like, oh my gosh, why did I not do this earlier? This is so much better. I'm getting so much more milk. It's so much more comfortable. It's crazy. That's a huge one, right? Using the wrong pump settings. Do we know what all the settings do? How do we find out which ones are best for us? That kind of thing. Difficulty with letdown, specifically at work. Pumping is easier at home. It just is. And if you pumped on maternity leave and you're like, this rocks, I got this, and you go back to work and you don't got this, you are not alone. That happens a lot. Even if you love your work and your work is supportive, we see that a lot. Another one is the techniques that you use during pumping, right? Pumping is not really like a plug and play situation. It's really an art, like a little dance to make sure that everything is falling into place. So that's something that I would look at, right? Your pump is only half the thing too. So another thing that can contribute to low pumping output is the products that you're using along with your pump, specifically cups, or maybe it's a wearable pump, or maybe you have a different flange style. These affect the pump's performance and they also affect how milk is removed. So that's something to consider as well. We also want to look at your comfort level. Are you stressed out pumping? This is particularly applicable to the workplace. Your milk expression schedule. That's another one. We got to check that out. Your environment, your mental condition, anything else that's going on in your body physically, your period, exhaustion, some of the other things that were low milk supply, but this happens too. And then we get low output and we think we've gone off the deep end, It's a lot. Okay. So if you were overwhelmed by that whole list of stuff and you're like, hey, I've heard these things before. I've heard flange sizing. I've heard power pumping. I've heard all this stuff. I don't know what to do for myself. That's exactly why I created my Pumping for Working Moms program. It's a step-by-step guide to give you all the information that you need and then easy access to me. We get to work together if you need me. You have easy access to a professional where you can ask me the little questions that come up before they turn into big problems. And I built it specifically for working moms. So a lot of it is self-paced and you got to be your own advocate. If you need help, I'm here, but I can't hold your hand. I can't come do the work for you, but we can make this easier because this is so confusing. Even as I was scripting this video, I'm just like, this is overwhelming to me. How are moms navigating these questions? How do you know if you actually have low milk supply or if you just are not pumping efficiently and getting all the milk out that is sitting there? I hope those lists, that kind of breaking that down helps you figure that out a little bit better for yourself and gives you some ideas of where to even start with tackling what's happening. Both of these things are problems that need fixed if you want to continue towards your breastfeeding goals. You don't have to do it alone though. All right. I'm here if you need me, but I do hope that this video gave you some at least better understanding, maybe some answers of things to try. And if not, reach out. I'd love to talk to you about how we can make this easier. Okay, tell me in the comments, what do you think? Low supply, low pumping output. Did you struggle with either of these? Are you currently struggling with them? I'm happy to chat with you down there about it, all right? Here's the next video for you to go watch, and I'll see you over there.